You're walking up the stairs, and your knee clicks like a pen. No sting, no swelling, nothing dramatic, just that tiny sound. You pause for half a second, wonder if something's wrong, then keep going. Later, getting up from the couch, there it is again. Today, we're going to turn that little mystery into something you understand and can act on, so you move with confidence instead of worry. I'll keep this in plain language and base every tip on real research and respected medical guidance. This is educational. It doesn't replace an evaluation with your clinician, especially if anything changes or you notice warning signs. A lot of people do two unhelpful things with knee sounds. Some panic and stop moving, which actually stiffens the joint. Others try to crack the knee on purpose, chasing a bigger pop as if that will fix something. Neither is necessary. Most painless clicks, what clinicians call crepitus, are common and usually not dangerous. According to the Cleveland Clinic, if there's no pain, swelling, locking, or instability, knee sounds alone are often harmless and don't need treatment. Mayo Clinic guidance echoes this. The red flags are pain, swelling, warmth, fever, significant loss of function, or a recent injury. Those are the cues to check in with a professional. So what's making that sound? Think of your knee joint like a well-sealed, well-lubricated hinge. Inside is synovial fluid, which helps everything glide. As you bend and straighten, small pressure changes can form and collapse tiny gas bubbles, a bit like opening a carbonated drink. That pop or click can also come from soft tissues, like the kneecap's surrounding structures gliding over contours. Harvard Health points out that these pressure shifts and tissue glides are normal, especially with activity after being still. The sound can be loud in a quiet room and still be benign. The key is how the knee feels, not just how it sounds. Let's do a quick self-check you can try right now. Sit tall on a chair with both feet on the floor. Slowly extend one knee, then bend it twice. Listen and feel. If you hear a click without pain or a catching sensation and there's no puffiness around the joint, that's usually a normal variant. Now do a slow mini squat, feet hip width, knees tracking in line with your second and third toes. Lower a little, rise a little. If the click shows up but there's no stab of pain, still likely benign. If you notice swelling that lingers more than a day, warmth or redness, a sense that the knee gives way, actual locking where you can't fully bend or straighten, night pain that wakes you, fever, or you recently twisted the knee and it ballooned up, those are the red flags. The National Institute of Arthritis and Musculoskeletal and Skin Diseases notes that symptoms like persistent swelling, pain, or instability deserve evaluation, even if sounds are present, because sound alone doesn't diagnose arthritis or a tear. Sound plus symptoms is what matters. Now, let's tune up how you move today so you reduce unnecessary friction and feel more in control. When you climb stairs, picture a flashlight shining from each kneecap. You want those beams to point the same direction as your second and third toes. That simple alignment keeps the patella, the kneecap, gliding smoothly in its track. Hinge at the hips like you're closing a car door with your backside. Keep your chest tall and place your foot fully on the step. Push through the whole foot, especially the heel and the base of your big toe, rather than letting the knee cave inward. If there's a handrail, use it lightly as a balance guide, but let your leg muscles do the work. This knee-over-toe alignment plus hip hinge strategy helps spread forces across the joint surfaces instead of concentrating them, something physical therapy guidelines emphasize for patellofemoral mechanics. Let's practice 2 brief movements you can revisit every day. First, the step-down control drill. Stand on a very low step. Just a book or a small platform is enough. Hold a wall or counter for balance if you need. Touch the free heel to the floor in front of the step, then come back up, moving slowly. Keep your standing knee tracking in line with your second and third toes. Don't let it wobble inward. Do 3 sets of 5 on each side, resting as needed. The goal is smooth, quiet control, not depth or speed. Second, sit to stand focus. Slide to the front of a chair, plant your feet hip width, and stand up without letting the knees knock inward. Think, press the floor apart gently to wake up your glutes. Do 2 sets of 8, slow and steady. If you're feeling uncertain, keep a countertop nearby for support. Before a walk or a set of stairs, spend 90 seconds on a simple activation and mobility mini-circuit. Place a rolled towel under your knee while seated or lying down and do quad sets. Gently press the knee down into the towel as you tighten the thigh muscle, holding 3 seconds and releasing. 6 to 8 slow squeezes is plenty. Roll to your side for clamshells. Knees bent, feet together, open the top knee just a little while keeping hips stacked. Think slow control, rather than a big opening. 2 sets of 8. Finish with seated heel slides. Draw your heel toward your hips, then slide it away, smooth and pain-free, 6 to 8 times. If you like bands, you can swap clamshells for mini band side steps along a counter. The idea is to signal the knee and the muscles around it, quads, glutes, and lateral hip, that you're about to move with control. Research summarized in journals like the Journal of Orthopedic and Sports Physical Therapy suggests that hip and quadriceps strengthening can reduce knee stress and improve function, especially around the kneecap. We're keeping it simple and gentle so it fits into daily life. Let's make this practical with daily moments you already have. Getting out of the car, scoot to the edge of the seat, plant both feet, hinge at the hips, and stand with the knee tracking cue. Rising from the couch, bring one foot slightly behind the other for leverage and avoid twisting as you stand. Changing direction in the kitchen. Turn your whole body, including your toes, instead of swiveling the knee alone. These little choices reduce torsion, those small rotational forces that can make joints feel grumpy. If your knee tends to click after sitting a long time, add a 30-second movement break each hour. Stand, do 5 slow mini squats with alignment. Sit. It's like reminding your joint, hey, we're moving again, before you ask it to climb stairs. Footwear matters more than most people think. Look at the soles of your regular shoes. If the outer edge is chewed down, your foot may roll outward and the knee may track oddly. If the inside edge is worn, the knee might drift inward. A neutral, supportive shoe with even wear encourages better alignment. This isn't about buying a fancy brand, it's about a stable base. If you like very soft, squishy soles, test whether you wobble side to side when you stand. If you do, consider something a bit more stable for long walks. Harvard Health often notes that alignment from the ground up, the way the foot meets the floor, can change knee loading. Small changes like lacing more snugly at the midfoot or adding a heel lock lacing technique can stabilize the foot without making shoes tight across the toes. A quick note about stretching. Aggressive long-held hamstring stretches before activity can make some knees feel more irritable. Swap that for gentle, active motion first. Heel slides, mini squats, and a short walk to warm up. Save longer stretches for after you move, and keep them comfortable rather than forceful. NIAMS reminds us that joints appreciate gradual changes, not sudden extremes. If the hamstrings are always tight, don't yank them longer. Build strength around the hips and core so you're not asking the hamstrings to do all the stabilizing. What about that satisfying bigger crack some people chase? It can feel relieving for a moment, but you don't need to force it. If a movement happens to make a noise as you go through normal range and it's painless, fine. But repeatedly twisting or torquing the knee to provoke a pop can irritate tissues over time. Think of it like wringing a dish towel. Occasional twisting is okay, but constant wringing wears things out. Aim for smooth repetitions and good alignment instead of loud sounds. If you're someone who walks daily and hears clicking mostly on hills or stairs, try a 2-part adjustment. First, shorten your stride slightly so your foot lands closer to your body rather than far in front. Second, on the step down, lightly tap your heel before committing your weight and keep your knee in line with your toes. These tiny tweaks reduce braking forces and give your kneecap a friendlier track to glide in. Many physical therapists use this exact cue set for people with patellofemoral symptoms, and while your knee may still make a noise, it often feels more comfortable immediately. Let's build a 7-day snapshot so you can see patterns. Grab a small notepad or your phone and, for 1 week, jot when it clicks, what you were doing, which knee, any swelling or soreness afterward, and what shoes you wore. That's it. A simple log turns vague worry into data you can act on. On day 7, look for clusters. Does it happen after long sits? Only on stairs at work with hard edges? More in a particular pair of shoes? The log also becomes pure gold if you decide to talk with your clinician. It shows frequency, triggers, and what you've tried. Now, 3 frequent errors and how to fix them fast. 1. Forcing loud cracks as a goal. Swap that for gentle range of motion and controlled aligned reps. 2. Letting the knees kiss inward on stairs or squats. Cue, press the floor apart to recruit your glutes and keep the knees tracking. 3. Only doing long static hamstring stretches. Replace the pre-activity stretch with our 90-second activation, then do comfortable flexibility work after you've warmed up. A bonus mistake, assuming sound equals damage. Sound without symptoms is common. Clinicians see it every day. According to Mayo Clinic and Cleveland Clinic resources, the combination that matters is sound plus pain, swelling, or mechanical symptoms, like locking or instability. Here's your simple action plan for today. First, start the 7-day click log. 2 lines per day is enough. Second, pick one movement habit to upgrade: knee over toe alignment on stairs, the hip hinge on sit to stand, or the step-down control drill. Third, practice the 90-second activation before your next walk or chore that involves stairs. If at any point your knee adds pain, swelling, a giving way sensation, warmth, redness, fever, or you remember a twist and pop injury with swelling, that's your cue to schedule a checkup. It's not overreacting, it's sensible. Let's do a quick recap so this really sticks. Painless clicks are usually normal, often tiny gas bubbles popping or tissues gliding in a healthy joint. Align your knee with your second and third toes, hinge at the hips, and move smoothly. Wake up the quads and hips with a 1.5 minutes of simple activation before you ask your knees to work. Log when the clicks happen so you can spot patterns and share them if you need help. And when in doubt, listen to the overall feel of the knee, not just the sound. Pain, swelling, locking, or instability are the signals that matter. One last human note. The goal here isn't silent knees. Plenty of healthy joints make noise. The goal is confident movement, climbing the stairs to hug a grandchild, walking for coffee with a friend, getting down to the floor to play with a pet, and doing it knowing you're caring for your knees, not fearing them. Noticing early and moving smart can mean more comfortable years with the people you love. If this helped, drop a comment. Does your knee click? Share this with someone over 50 who mentions their knees at every staircase, and hit subscribe so you don't miss what's next. Coming up on Thursday, a practical, knee-friendly walking tweak that takes 5 minutes. On Saturday, we'll cover subtle signs of knee swelling you might be overlooking and what to do about them. Stay curious, keep moving, and take care of your joints. Information guides actions. Don't stop medications or delay care based on a video. Talk to your clinician if something doesn't feel right.